Hello, my name is Dr. Shruti Sastry. I'm a Pediatric Endocrinology consultant at Aster Hospitals, Bangalore. And today I have with me the lead consultant of Pediatric Endocrinology, Dr. Kavitha Bhat. So I will be asking her a few questions regarding diabetes in children, which is often different from diabetes in adults. So, hello Dr. Kavitha.
Hi Shruti.
So, I wanted to know if the treatment for diabetes in children is similar to the ones that we have in adults?
No, not actually, because diabetes in children is a different disease altogether, though they have the same name. Diabetes in children happens because of destruction of insulin producing cells of the pancreas, and insulin producing cells of the pancreas do not have the capacity to regenerate. Hence it's a permanent kind of diabetes, and we need to treat it by replacing the insulin that the pancreas usually produces. Whereas in adults with diabetes, it's most commonly type 2 diabetes, which is due to resistance to insulin action, meaning insulin is being produced but it's not acting as it should at the level of the cells. Hence, oral medications or medications that can be taken through the mouth that sensitize the body towards insulin actions help to maintain blood glucose levels in adults with type 2 diabetes. Whereas in type 1 diabetes, insulin has to be administered and it's through injections.
Okay, that's interesting to know. So why can I not give this insulin through the mouth? Why does it not come in a pill form? Is there any specific reason for that?
Insulin cannot be given orally because it can get digested. It's a peptide hormone. It can get digested and not absorbed. It has to be given as an injection into the subcutaneous tissue.
Okay, that is good to know. So this also means that diabetes in children cannot be reversed the way that it can in type 2 diabetes or in adult form diabetes?
Right. Type 1 diabetes, which is the most common form of diabetes in children due to insulin deficiency, cannot be reversed. Whereas type 2 diabetes, which is the most common form of diabetes in adults, due to insulin resistance, can be reversed to a certain extent with lifestyle changes like weight loss, exercise.
So at what age do you think that I should be looking out for these signs of diabetes in children?
Diabetes in children happens most frequently at two periods in a child's life. One is at school entry, when the child starts going to school, which is around 5-6 years of age, and another when the child enters puberty, usually around the teenage years. That does not mean that diabetes will never occur in other age groups, but these are the two peak age periods when diabetes occurs.
Which means that even if my child develops this at 15 months or at 1 year of age, it can still be diabetes.
Yes. So a child as young as 15 months or as old as, say, a teenager as old as 18 years can have diabetes, which is type 1, and that requires insulin. So every parent, if your child who has stopped bedwetting but begins to bedwet again and starts drinking a lot of water, is thirsty and has increased appetite, and despite this is losing weight, energy levels are lowering, then parents need to keep this in mind as one of the possible causes.
So how would I know that this is type 1 diabetes and not type 2 diabetes? Say, because everybody is scared because of the lifestyle changes, because of the junk food intake and everything. Does my child have type 2 diabetes or type 1 diabetes?
Yeah, there are certain clinical clues that point towards type 2 diabetes or the kind of diabetes that can be managed with pills or lifestyle changes. The type 2 diabetes is most common in teenage years. It's most common in children who are obese and overweight. It's a very gradual onset, meaning the symptoms are so subtle and it may be picked up incidentally, during the course of a blood test done for some other cause, versus the type 1 diabetes, which is the most common cause in children, that can present with an acute, severe, a dangerous condition called diabetic ketoacidosis. That's the most common presentation of the type 1 diabetes.
Okay, and that's good to know. And also there's typically a test known as an antibody test that we can do in order to differentiate between type 1 and type 2 diabetes. So in case your child is positive for these diabetes autoantibodies, it is more likely that this is type 1 diabetes, and if this has been ruled out, then it is likely that this is type 2 diabetes.
Right. Shruti, I have a question for you. As a parent, if I have a child with diabetes, I have to give my child about 4 to 5 insulin injections every day and check the blood sugar with the finger prick, glucometer about 7 to 8 times every day. This can be very tiresome and very difficult. Is there anything available which can ease things for me and my child with diabetes?
Yeah, I mean, definitely I understand that it is hard for a child to be pricking their fingers multiple times a day, as well as the fear of the insulin needles more than the injection itself is quite traumatizing. So there are new technologies that have come up that make it much easier for the family as a whole. So the first one is checking the blood sugars. So there is something known as continuous glucose monitors, which is a small device that sits either on the arm or another part of the body, which continuously checks the sugars of the body. So this does not have to be changed for 10 to 14 days in a row. So there's no multiple daily pricks, and you'd only have to have a device that can connect Bluetooth to the continuous glucose monitor. So you continuously get what the blood sugar of the child is on either a phone or a reader. The other thing that can help is known as an insulin pump. So an insulin pump will have insulin in the device itself, and it is attached to the body, and this only needs to be changed every 3 to 4 days. So you can avoid giving multiple injections through the day, and this also helps in better control of the blood sugars using this continuous glucose monitor and this insulin pump therapy.